Welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have a great guest today. This is Anthony Zaleski. So, Anthony is from Boynton Beach, Florida. He's a UF undergrad student with a degree in finances and currently is the third year PT student here at UF. And he will be graduating in May. Not too sure what kind of patient population he'll be working with. I have a feeling at one point it's going to be some kind of oncology population mix to whatever else he wants to do. For fun, he loves to go to the beach, skimboard, fishing, hiking, play sports. And you live as well, like in West Palm Beach area, correct?
Yeah, in the Palm Beach County area.
Yeah, perfect. So
Mhm.
Anthony is just finishing up this week his 8-week internship here. So we just want to hear all about it and how was your experience. So
Thanks for having me on.
absolutely, thank you for being part of it after like a lot of insistency.
A lot of insistence. First podcast ever. We'll see how it goes.
See, you're gonna do great. So, can you tell us a little bit about your journey into physical therapy and what led you choose first physical therapy? You went from finances to physical therapy and then physical therapy and how you land in an oncology internship.
Yeah, so my degree, I was at UF from 2014 to 2018. My degree is in finance, and I wasn't really sure at the time what I wanted to work in. I was good at math, so I kind of got focused on statistics. So I moved to Texas, and I was planning on becoming an actuary. And then just over the course of working there for several years, COVID happened, started working from home, and it gave me a lot of time to sort of think about, do I like what I'm doing? Do I want to do something different, or is this it? And over time, I started thinking PT was always kind of something that was in the back of my mind. So it started popping into my head, and I gave it a year. I was like, okay, over the next year, I'm still going to work at this job. And if it's still in my head when that year is up, make the switch. So I ended up doing that. I moved home. I took all of these prereq classes that everyone else already has done just to apply to PT school, all the bios and chems and everything like that. I had to retake all of that. I was working part-time, got plenty of shadowing hours because I wanted to give myself the best opportunity to get into a good school, and it worked out. Got into UF, and I think it all stemmed from, my sports background, and PT was always something that I was interested in, even in undergrad, but I just didn't really have the confidence. Or I was like, healthcare field, seems difficult. I don't want to do that. I don't know. And then I just made the jump, and here we are.
Awesome. And I think you did the right jump. So I think
I
that
hope
you're
so.
like
I think
really,
so.
I think this is like, it's certain personalities that I feel like no matter what setting you are, but it's certain personalities that definitely you can be in patient care
Hmm.
versus I've been coming across as well as students who definitely they're gonna be better off on the business part of it
Hmm.
because they don't have that kind of like tactile magic communication skill, and I
Yeah.
think you do. So I think you'll do well at it.
Yeah. I think that kind of played into what I was doing before. I was sitting behind a desk, and I know we still do a lot of documentation and computer work, but interacting with the patient and just talking to people is something I like to do.
Yeah,
So.
yeah. Great. Why oncology? How did you land here?
Well, to be fair, I kind of just got switched into it.
See.
I was going somewhere else for this internship. I was supposed to be in Atlanta. And then at the last second, they said, this is available. Are you interested? And I was like, yeah, let's do it. I mean, I know we had you in class for the one lecture about lymphedema. To be honest, it was kind of in the
Yeah,
back of my mind. I'd forgotten.
yeah.
I knew it happened, but I'd forgotten the specifics of it. So getting in here and learning all about it again it's been great.
Awesome. Um, what was, do you have any personal experience or inspiration that drew you into, well, I know that was kind of like something that happened suddenly,
Hmm.
but do you feel that is anything that you did in the past that helped you to navigate through this internship a little bit more?
I mean, I think everybody kind of has potentially a personal history, family history with cancer. So everyone's going to be able to connect with it on some level. My mom had colorectal cancer and breast cancer.
I didn't know.
Yeah.
Okay.
Several years ago. So when I was living in Houston, she came out for treatment at MD Anderson.
Okay.
So that's where she had her treatment done, and everything's good with her. They caught it early. So,
Great,
yeah,
great. Well,
everything worked out really well.
well, for 8 weeks and I didn't know this at all. So I'm sure that you've been giving her some good tips based on what you've been learning
We
here.
talked about it. When I started, I was like, oh man, I'm learning this, I'm learning that. And she was like, yeah, that's all stuff I had to do. And I was like, I had no idea.
Yeah,
Yeah.
absolutely. What does a typical day look like in an oncology setting?
So I always try and get here probably like 30 minutes early, try and chart review. It's a lot of similar patients. We're kind of focused on the breast and the head and neck and things like that. And with Annalise, I do some of the pelvic stuff too, so prostate, things like that. But from what I've learned from this internship is everyone's at that different stage of treatment. So you never know. They could be going through chemo or radiation or have already had surgery or haven't had it yet. So it's a constant start and stop and figuring out where the patient is in their treatment, what are their impairments, what are we going to be working on today, and yeah, going throughout the day.
So you already kind of mentioned it that you're seeing most of the conditions that you've been working with is breast, head and neck, and some pelvic health as well in regarding prostate or any kind of gynecological cancer. What area do you feel like, okay, like I know my goal or our goal, you were just really 1.5 days maybe of an internship a week with me. Most of the time was with my colleague Annalise. But what do you feel like, you going strong at? Like if something in the future, you're in a clinic outpatient and a patient comes in with either breast, head and neck or some kind of pelvic health cancer, or pelvic cancer, sorry, what do you feel really confident about it? All of it, one specific, or what are your thoughts?
Me specifically, when we're treating them, I think I came in with relatively good manual skills in terms of not being afraid to get in there with the patient, because that's obviously a big shock coming in. It's a sensitive area for women or for men with the prostate, things like that. So being comfortable and being professional in terms of, okay, this is something that's for your care. We're going to be treating it and just, treating it medically and going from there.
So you feel pretty confident, like I say, you will be graduating in May and you're in an outpatient clinic and you have somebody on the door coming with a prostate cancer diagnosed because nobody else in the clinic you work with know how to treat that, or breast or head and neck.
Yeah.
Is any particular area that you feel really confident with, or you feel like, all of it, I think I can swing it?
With the prostate specifically, or
With
just in general?
Any of those.
I mean, I've also learned a lot about the education in terms of when you're chart reviewing, you get to know, okay, here's what their diagnosis is, how severe it is, here's what their course of treatment looks like, what are they taking in terms of medications related to it, whether it be hormone blockers, things like that. And so then connecting the dots and providing education in terms of here's what the side effects are, here's what you might be feeling, and here's how we're going to deal with that with treatment in terms of exercise or swelling management, compression. So I guess a little bit of everything.
Yeah, exactly. So that's exactly the idea. It's like you guys learning tools, that you have a general education. And of course, I think that I love it when my former students, then professionals, reach out to me and say, I'm doing this CHIPAC today on this patient. What is the name of the things so we can build this CHIPAC with? Or they hire me and they have no idea about oncology and they want to establish a program, how you guys have it. And I already have these tools. It's really nice to see, because again, like you say, a lot of us are going to come across, even if a sports or an orthopedic setting, into having a background of some kind of cancer diagnosis, either for themselves, the patient himself, or any relative. So I think that all the education is going to be really important for all of it. So,
yeah.
Very good. What surprised you the most about working with cancer patients from the PT perspective?
I would say when patients come in, obviously they're dealing with a lot, but the majority of them have I'd say they all have tons of resilience.
Mhm.
They continue to come back to PT. They understand that it's important. And even though they are dealing with this serious disease, I still am able to find a way to sort of joke around with them most of the time or keep things somewhat light while we're still treating them for something that's terrible.
Mhm.
And so, I feed off their energy too.
Mhm.
And so they come in and I feel like they're doing well. I'm like, that's great.
Mhm.
Everything's going well. And we just,
Yep.
let's keep it going and we work on what we can, improve, and then go from there.
Yeah, that's a very good point. So I think resilience is one of the things I was because I used to do orthopedics for many years before doing oncology, and then one of the things that totally saw me into oncology was the patients. It's just the resilience there. I was doing a podcast with a patient with head and neck with 4 surgeries, and you're going through all these, issues changing your face and what your mouth looks like, and you're still throwing jokes and you're still like having fun with it. So it's like, oh my God, like how do you see life that way? But I think that that's what happened. Cancer changed your life, right?
Yeah.
Really, the way that you see life and the way that you see small stuff. So sometimes that's what I say to everyone is like, I'm meeting all these patients and relative of these patients, and they go through so much that sometimes it's like, I really don't have nothing to complain about in my personal life because, I'm really like, sometimes we're like, oh yeah, I have the neck pain or, the kid or my son didn't behave or whatever it is. And really, that's really small in the middle of what these patients going through. So
yeah, sometimes you have to pry information out of them because you sit down and you say, how's it going? They're like, everything's good. I'm like, all right, tell me more.
Yeah, exactly.
We need to know more.
Exactly.
And also not only mentally their attitude and how they're able to do it, but say someone wasn't, they're super tight and they weren't able to raise their arm, just physically how resilient people are in terms of finding those compensations of ways to still do things. It's not necessarily how we want them to do it forever because we
But
want to
they can
improve
do it,
on that
yeah.
in the future, but they're still able to get by day to day and do it.
Yeah.
So that's pretty cool.
Yeah. What are some clinical skill or knowledge areas that you found especially important in this setting?
We already kind of touched on it, but the manual is super important. So, I mean, they start you off in PT school and you're getting hands-on classmates in terms of palpation, things like that. But it's totally different doing it with oncology patients in terms of you're in sensitive areas, you're working on the breast, you're doing intraoral things for the TMJ, things like that. So you have to be really comfortable with that. And then we also talked about the education in terms of knowing what medications they're taking and getting a sense of, okay, once they finish radiation or chemo, here's what they should expect for the future. And so picking up those things over time. I mean, I guess you wouldn't know it unless you did an internship here, but I've picked that up over time. And I think it was really good.
Yeah, and again, sometimes students are a little bit lost in like, oh, I'm going to go to an oncology setting. I really don't know what I'm going to do there. But really, you do the same thing you do with any orthopedic setting, but you just add in the flavor of what chemotherapy side effects can create and how you can mitigate those, or what radiation side effects are doing and how you can mitigate those, or any pre or post surgery things that you can educate patients with. So really, it's the same manual therapy skills you have to treat anybody else, but you just have to take in consideration these other elements that can happen during their care.
Right.
How do you balance compassion and professionalism when working with patients who may be facing a serious or terminal diagnosis?
I don't necessarily think that those two things are mutually exclusive. I think they kind of go hand in hand with one another. There is a balance between obviously being professional and not digging too deep. Is that kind of what you're going for? But I don't know. I think my tendency is to just be as positive as possible and provide that energy for the patient. And then they sort of most of the time appreciate that. And yeah, I don't know. I think compassion is just something that I naturally have.
Yeah.
So explaining it is kind of difficult.
Yeah.
I feel like it just happens.
But sometimes you can be this is what we hear many times from patients, right? I went to A was the physician or whatever, and they were like, absolutely didn't care, or they feel that way because their personality, or because sometimes people like to be sugar about certain things. Some people does not like to be such a direct, and everybody's different, right? So everybody takes things a little bit different. So so I always kind of like, it's important to be compassionate about what the patient going through, but at the same time be realistic, and at the same time be like, okay, I get it, I understand how down you feel, but we gotta do this, and we need to move on this, because we can be here for an hour crying about it, but what are we gonna do about it, right? So it's kind of like being compassionate, but at the same time continue improving whatever we're doing with them. All right.
I agree.
Okay, perfect. Sorry. What is one thing that you learned during your internship that you think all PT students should know about oncology rehab?
I would say that it's not just about drainage. That's the one thing that we kind of learned about with you coming in. And it's a big combination of a lot of different things that you learn in the clinic. Like we talked about the manual, the education, the having the compassion, that patient professional relationship, exercises. We're doing exercise with people in here too. It doesn't matter whether their diagnosis is cancer or whether they messed up their shoulder doing something. We're still treating them with exercise, manual, and all of the sort of key components that you learn throughout PT school. It's just being applied to patients who have a cancer diagnosis.
Exactly. And don't be afraid of that, right? So we've been talking many times about how we can underdose these patients, right? Because again, for years, we used to be, oh, somebody have cancer, don't move. Oh, no. Caregivers, I'm just gonna bring food to the bed. You don't have to come to the dining room table.
Right.
And don't do anything, don't move, stay like no anymore, right? So we know now it's all about exercise, high interval training prior to chemotherapy, really doing all these things that is just gonna make you feel better versus just really do nothing and then you just kind of go downhill.
Yeah.
So definitely, as just don't be afraid of that, because sometimes we tend to be afraid of, like, you have a patient with a post-mastectomy and then you have a patient with a shoulder rotator cuff rehab, and then you will not think twice to underdose your rotator cuff, of course, depending what part of healing they are.
Right.
But you're more afraid of pushing the post-mastectomy patients because you're afraid you're going to hurt them.
Yeah.
So yes, it's the same muscles, same healing process, same shoulder, same tissue. So we shouldn't be treated it any differently. So
you got to keep them going.
You got it. What has been some of the biggest challenges that you encountered during this internship?
Biggest challenges. Bouncing between two CIs is hard with different styles.
Yep.
But it's been good. I've learned a ton from both of you. So I take some from you, I take some from Annalise, and I try and make it into my own style of treatment. So I guess that's something unrelated to the patients directly. But I think what we've already touched on is just understanding the underdosing and treating them the same way, a similar way we would treat an ortho patient or something like that, and providing them with the same adequate treatment that they need to get better and not babying things.
Okay. And then what advice would you give to another PT student considering a clinical in oncology rehab?
I would say do it. You learn a lot. It's been a great experience, and yeah, I'm really happy I came here instead of going to the other place.
Awesome.
It's been great.
Awesome. Well, thank you, Anthony. We really appreciate having you here. I know this is sometimes, this is your second internship, and sometimes it's a lot in your plate, and it's a lot on a specialty clinic during 8 weeks. I think that now when you finally feel independent and you finally feel you're getting things finally going down, boom, you're leaving. So it's like, okay, this is kind of a short time for so many things that you're learning. And so, but you've been really a great player and just really jumping, not being afraid to be like, okay, I'm not too sure how I'm going to manage that, but I'm going to jump in and do it. And then you just learn as you go and just really take advantage of like, how wonderful patients we have. And they're all willing to help out. And they're like so used to us having the students, like they're really great and appreciate you guys. And as well, I appreciate them for allowing you guys to learn with them.
Yeah, absolutely.
Yeah, but thank you again for doing this with me.
Thank you for having me.
Okay, great. I'll see you later.